Hi, I'm Mike from Physical Therapy here at GBMC. I'm just going to work you through a couple exercises for the total knee replacements that your surgeon really want me to cue you on. If nothing else, if you wake up in the morning and say, boy, I don't feel like doing anything, these couple exercises will probably be the best ones you can do. What we're going to try to do is really focus on flexion, getting your knee to bend as much as you can, and extension, getting your leg as straight as you can. The reason why it's so important, if you do nothing else, why you want to do these exercises, is just because from the time you left the OR, your body starts to heal, adhesions and scar tissue start to form, and there's just a short kind of window that you have to try to get that range of motion. And once that window closes, unfortunately what you got is kind of what you got. So we got to get what we can while we got time to get there. And so, and I'm sure your surgeon's gone through it before, if you don't get that range of motion as far as flexion, that is getting your knee to bend as much as you can, then in about 6 weeks or so, then he'll talk to you about maybe wanting to do a manipulation. And that's when they bring you in, put you underneath anesthesia, and kind of re-break things underneath anesthesia. What they break isn't bone, it's the adhesions and scar tissue that start to set up from the second you left the OR. And both you and your surgeon are fighting the same time clock. You're both fighting your human physiology and trying to get your range of motion as quick as you can. If we can't get that leg straight as possible in about 3 weeks or so, then your surgeon might talk to you about maybe doing a dynasplint on your leg. That's a splint that wraps around your thigh, another part around your calf, and then there's a screw that sits on top of your knee that you have to crank on it. That you got to wear sometimes like 5 hours a day for 3 to 4 months. But the good news is an ounce of prevention is worth a pound of cure, so if you can prevent things from happening, it will be non-issue. But the thing to remember as a patient is, if nothing else, this is unfortunately your responsibility as far as getting that range of motion, because it's nobody else's problem in the whole wide world, unfortunately. It's not your kid's problem, it's not your spouse's problem, it's not your dog's problem, or the surgeon's problem for that point, because they're not the ones that will have to live with it for the rest of their life. So you really want to get that range of motion as quickly as you can. Alright, so the first thing what we're going to do, the first exercise we're going to do is basically called a heel slide, and that is we're going to do it from a sitting position. I'm going to grab my sheet, and what we're going to do is we're going to do it from a chair, but if you want to do it at home, laying in bed, sitting up in bed, a chair like this, chair in an ottoman, chair in a coffee table, wherever you feel comfortable, it's fine. Okay, don't get on the floor just yet because you might have a hard time getting back up. So basically what we're going to do is we're going to try to slide your heel towards your bottom, bending your knee to the chest. Then you're actually going to hold that for 30 seconds to a minute. And then you're going to stretch it out, push your knee straight down, try to get your leg as straight as possible. Hold that for 30 seconds to a minute. So you're going to slide it up, hold it for 30 seconds a minute, try to get that bend. Each time you do it, try to get a little bit better than time before. So even if it's just 1/8 of an inch, 1/4 inch, in theory, the 20th time, somewhat 20 times better than the first time. Push it down. You're going to do what they call a quad set. Get it nice and straight. Really push your knee down nice and straight. Kick that heel out. Hold that for 30 seconds to a minute. Now what we're going to do is we're going to cheat using a sheet, because you always want to use a sheet or something to help pull that leg up. Now we're going to use a sheet just because they're plentiful in the hospital and I don't have to pay the laundry bill. But when you get home, anything will do. Alright, you can use a sheet, TheraBand, yoga strap, belt off your robe, belt off your pants, a cane, those invisible dog walkers, they call them leg lifters, anything will work. Alright, so basically what we're going to do is we're going to take our sheet, we're going to put it in the arch of the foot, and then we're going to slide our heel towards our bottom, bend our knee to the chest, and then we're going to push it down nice and straight. Now for even better pull, what you can do is you put the sheet on the arch of the foot, and then cross in front of the ankle, and then come underneath the knee, cross again, and it just gives a little bit better angle pull, so it can help you pull that knee up a little bit better. When you slide up, especially when you're doing it at home, you're going to slide your heel towards your bottom, bend your knee to chest. You're going to hold it there for 30 seconds to a minute. The reason why you want to hold it is because a sustained stretch is the best kind of stretch you can get. And then you're going to push it down and hold it nice and straight. If you can hold it for 30 seconds to a minute, that'll be great. So you're going to pull it up, hold for 30 seconds to a minute, push down, hold that for 30 seconds to a minute. If you do 20 or 30 of those, that'll probably take you about 40 minutes to an hour to do. Do it when you're watching TV, in the morning and the afternoon. And like I said, if you do nothing else, if you do this 2 or 3 times a day, and then let therapy work you through the other exercises, then that'll be fine. But again, you're going to slide your heel towards your bottom, bend your knee to the chest, hold it there till you feel a really good stretch, hold it there for 30 seconds to a minute, and then push down and hold that for 30 seconds to a minute. Now for our second exercise, what we're going to do is basically what we did just for the first exercise. Basically, it's like doing a heel slide with your foot on the floor. We're going to sit in a chair and do it. Doesn't really matter what kind of chair you're using, but the key to doing the exercise is twofold. One, you have to be on the edge of your chair. If you're sitting too far back in your chair, then physics isn't going to allow you to get the leg straight, and we said how important it is to get your leg straight for that extension. So we got to get all the way on the edge of the chair. Now if you got carpet at home, what I recommend is putting a plastic trash bag underneath your foot, and that'll get that leg extension, allow things to glide a little bit easier and kind of take friction out of the equation. If you got wood surface or tile, then you can always use like a washcloth. So that's what we're going to do here is, since we're on a wood surface, we're going to use a washcloth. Basically what we're going to do for the exercise, we're going to be on the edge of your chair. We have a washcloth underneath our foot. If you got carpet, again, use a plastic trash bag. We're going to slide our legs straight out. We're going to point our toe to the ceiling, kick our heel out, and push that knee straight down. The key to doing this exercise, do not keep your foot flat when you fully extend the leg. Physics isn't going to allow you to get the leg straight. So the only way really to get that leg straight, you got to point your toe to the ceiling, kick that heel, push that knee straight down. And then what we're going to do is we're going to bring that leg straight back, try to get back as far as we can. We're going to hold that for 30 seconds to a minute because a sustained stretch, remember, is better than a quick stretch. And again, toes to the ceiling, kick that heel out, push that knee straight down. Again, hold that for 30 seconds to a minute. Now remember that we also want to cheat using the sheet, TheraBand, yoga strap, belt off your robe, whatever you have. And that's going to help us bring that leg that much further back. So I'm going to demonstrate using the sheet again. And so we're going to put the sheet on the arch of our foot and try to hold it thumbs up, and that way we can use our back muscles to help pull it back, just like when you guys are all in the gym using a lat machine. So you're going to slide this back till you feel a good stretch, hold it for 30 seconds to a minute, and then push it down, get it nice and straight, hold that for 30 seconds to a minute. Now for even a little bit better leverage or pull, put the sheet on the arch of your foot, cross in front of the ankle, come underneath the knee again and cross, hold your sheet with thumbs up, pull back, hold it for 30 seconds to a minute, push that knee down nice and straight, toes to the ceiling, hold that for 30 seconds to a minute. Major, major dividends. Now if you don't want to use a sheet, if you don't have a sheet, what you can always do as well, if you do have a good leg, is instead of using a sheet, you can bring your good leg over the bed and help pull that back. Okay, and that'll work too. And then again, try to hold it for 30 seconds to a minute, push it down nice and straight, hold that for 30 seconds to a minute. Again, the key to doing the exercise, you got to be on the edge of your chair. If you're sitting too far back in the chair, again, physics will not allow you to get the leg straight, and then we said how vitally important it is to get that extension, all right, getting that leg straight. You got to be on the edge, kick that heel out, push that knee straight down, toes to the ceiling, and then pull it back and hold each stretch, both in extension and flexion, for 30 seconds to a minute each. The last thing we're going to do basically is ankle pumps and then seated heel to toes, which are basically ankle pumps with your feet on the floor, where you're going to bring them all the way back, try to touch your toes to your nose, and then push all the way forward, all the way back, all the way forward. The reason why it's so important, because after your surgery with a total joint replacement, very high incidence of getting blood clots. That's why your surgeons do everything they do, and that's why you're getting some sort of blood thinning medication for a period of time. But the one thing you can do on your own are these ankle pumps. Bring your toes to your nose and then push all the way forward like you're stepping on a gas pedal. Bring your toes all the way back as far as you can. Keep those legs nice and straight, and then push all the way forward. That gets the circulation going, and that really helps prevent blood clots, because unfortunately, the less mobile we are, the more likely we are to get blood clots. And you guys aren't super mobile now. You weren't super mobile coming in. So it's really important. Just try to do this throughout the day for the next couple weeks. Now, we're not holding the stretch, because actually the benefit of doing the ankle pump is getting that pumping action. So all the way back, all the way forward, all the way back, all the way forward. The other variation which you want to do when you're sitting in a chair, just sit up, keep your feet flat on the floor, and basically you're doing ankle pumps with your feet on the floor, where you're going up on your toes like you're a ballerina, and then bring your toes all the way up to the ceiling. So you're going up on your toes, and then bring your toes up in the air. Try to do this as often as you can. Now from now on, long car drives and airplane flights, make sure you guys are doing this. And you actually want family and friends to do it as well, because plenty of people got blood clots on long car drives and airplane flights and never had joint replacements. So you just contract and relax those muscles. When we walk, we land land on our heel, we push off on our toes, so working the muscles we do that with. But again, by doing it, we're contracting, relaxing those muscles, working as a pump, keeping that circulation going. What I would recommend, if you're doing these exercises at home, do them like 2 or 3 times a day, and maybe about 20, 30 times each. And so if you're doing them 20 or 30 times and you're pulling it back, you hold it there for 30 seconds to a minute, and then you're stretching it out and hold that for 30 seconds to a minute. That'll take you like 40 minutes to an hour to do. So do it when you're watching your favorite TV program. Your home therapist will be able to work you through these exercises, in addition to probably give you a lot of other ones. If you have any other questions, you can always call your surgeon. If nothing else, make sure you want to do these exercises for the next 6 weeks. And then when you're done and your surgeon says, boy, you really don't need any therapy anymore, I would continue to try to do these exercises at least 10 minutes a day, 10 minutes every other day. If nothing else, or maybe ride the exercise bike, because adhesions and scar tissue build for a year, and you really want to keep that at bay for a year. We really hope you do great. Keep smiling. I hope you have a great time in your rehab. And from everybody here at GBMC, we wish you the best of luck.